Hello and welcome back. This is Dr. Puya from Gainesville Complete Dental with another video. My goal is to talk about dental implant from the time that unfortunately we need to get one of your teeth out to the time that you get your crown. Since it's a process of different procedures, I don't think so we can do everything today. So for today we start little about how we remove the tooth and how we do the bone graft and why we do it, and next week hopefully we talk about the implant itself, how we're going to place it in. Okay, let's do this. First of all, I'll show you briefly how we take the tooth out. So see this, the tooth is a little mobile, it's coming out, so it's a hopeless to stay there. So what we're gonna do, we're gonna put we call this elevator. We put between the bone and the tooth and try. That's the pressure that you feel when we want to get the tooth out. A little pressure here, little pressure there, and then gonna use our forceps and we just go and easily remove the tooth. As you can see now, let me use something. Here now there is a big hole, so it was the 3-root tooth. We get it out, so it's a hole. So since we want to do implant in future in this place, we need this hole to fill up with bone from your body. The thing is, we need a specific amount of height in the bone and thickness in the bone to place the good and reliable implant inside of this socket that we get the tooth out. So if leave this place empty without doing anything, then your body makes bone for us, but not all the way in the top, and our jawbone is staying there as long as the tooth is. When we get the tooth out, the bone start getting thinner and shorter. Then it makes it very hard for us, especially this is for the upper teeth, especially our upper teeth. We have here kind of mimicking the sinuses, the maxillary sinus. So if we get short bone here, we cannot place without any surgery. I mean, there is something else we talk about in future about sinus lift, but without that we cannot place the implant. So to do that, we're gonna place some bone or bone grafting here inside of this bone, and then we cover it with a membrane or barrier, because the other thing is when we leave this empty, so it's gonna fill with the blood gonna clot and stay there, and by the time that's dissolved and bone gonna replace it. The other thing is, if you're not placing that bone graft here, the gum can grow into this socket and stop your body from building enough bone for us. So that's why we put a barrier here to stop the top layer to go inside too. So we get the tooth out, we're gonna start building or putting this bone inside of the socket little by little. So I filled it up, put a little more. And again, gently press it in. So now our hole is filled with the bone graft. Now we're gonna place the barrier. And we gently put that barrier between your gum and the bone. Look, so you see, you just cover everything. Then we put the suture to hold everything together. Okay, we did the suture too. We're gonna cut the extra part. Bring the scissor. Okay, so we put the bone graft, we put the barrier, we put suture across the gum to hold everything together. So we're gonna wait, based on the material and based on your experience, I usually wait at least 3 months for your body to use this pathway to make bone for us, and then we go in and place the implant. We talk about the implant next time and how we place it. I try to show you as much as possible. The way that we are doing is very easy. It's not something to scare about. That's my goal to see. So we got the tooth out, we put the bone graft, we put the barrier, we put the suture. We usually get you back in a week or 2 weeks for follow-up, and then in 3 months you're gonna come back to place the implant. Hopefully this helped. That's all about today. We see you next week and we continue the same subject. Don't forget to wash your hands multiple times, at least for 20 seconds, and do not touch your face, mouth and eyes as much as possible. Hopefully you have a nice week and see you next week. Bye.